Hello everyone, my name is Yessenia Gonzalez and today I will be speaking about Myasthenia gravis. Let's begin with the pronunciation.
Myasthenia gravis.
My means muscle, asthenia means weakness, gravis means grave. With that being said, myasthenia gravis is a neurological autoimmune disease that causes muscle weakness. A patient with this diagnosis becomes very fatigued when doing excessive amount of activities. Once the patient takes a break, the muscle weakness diminishes. In this rare autoimmune disease, what happens is that the antibodies destruct the neuromuscular connections. Due to this, the nerves are unable to communicate with the muscles. This mishap affects the voluntary muscles, which include the eyes, mouth, and limbs. The symptoms of MG include double vision. I've inserted an image of a gentleman with a double vision effect to get a sense of how a myasthenic patient might see when experiencing double vision. Other symptoms include slurred speech, breathing problems chewing, seeing, holding your head up, slurred speech, drooping of both eyes, walking, and unable to use your arms or hands. Keep in mind that hot and cold climates can aggravate symptoms. Myasthenia gravis is diagnosed by using a variety of tests. For example, an antibody test detects the presence of antibodies that prevent nerve-to-muscle interaction. Then we have an interferonium test where a drug is injected, and if weakness seems to disappear, it is confirmed. This effect only lasts about 5 minutes. Then we have a CT test where it checks for thymus gland, tumors, and abnormal thymus glands. Who gets affected by myasthenia gravis? Usually it affects women under the age of 40. It affects men over the age of 60. Generally, it can be diagnosed at any age. Neonatal myasthenia is common when the mother has myasthenia due to the child acquiring proteins from the mother. The child might experience some MG symptoms but usually disappear. Even though there is no known cure for myasthenia gravis, there are many treatments available. Plasmapheresis involves a catheter being inserted through the neck. It is a procedure where the plasma is separated from the cells and is replaced with good plasma. You can see the model for a better understanding. Thymectomy is a surgical removal of the thymus gland. The goal for this is to increase the chances of being symptom-free. Lastly, we have IVIG, which is an IV-administered treatment that infuses polyvalent IgG antibodies collected from the plasma of blood donors. Of course, every case is different, but here are a few medications that are used to control MG symptoms along with their treatments. For example, we have Mestinon, which comes in the time-spent form and a 60 milligrams form. The time-spent form is used at night since we use different muscles at night, whereas the 60 milligrams is used in the daytime and is usually prescribed to take every 4 hours. We have mycophenolate, which takes about 3 months to take effect, whereas the Mestinon has a shorter amount of time to work. All these medications have the same intention to improve muscle strength by suppressing the production of abnormal antibodies. With treatment and medication, most patients are able to live a normal lifestyle. Other patients go into remission either permanently or temporarily. Other cases, the myasthenia gravis might become very aggressive and lead to a crisis. What research is being done? As of now, researchers are looking to find a better understanding of the relationship between myasthenia gravis and the thymus gland. They are experimenting with new medications combined with ones that exist already, and their goal is to see how effective they are. Researchers are also trying to learn if antibiotics contribute to the development or aggravate the myasthenia. I only hope that with time, a permanent cure could be found. Thank you for watching my presentation.